Hello, friends. Welcome to another edition of the Lovecast. You're in for a treat today. I have the privilege of sitting across the virtual podcast table with somebody who's really just an intriguing human being doing incredible work. Her name is Rachel Beanland. Did I get to pronounce that correct? And Rachel is coming to us all the way from the beautiful country of France, Southwest France in the Pyrenees Mountain region. Rachel is a medical doctor, but Rachel is also a yogi. And I'm super excited to get into a conversation with not only a medical doctor, but also a yogi. So Rachel, welcome. Thank you for being a guest on the Lovecast podcast.
Thank you so much for inviting me. I'm really looking forward to chatting with you today.
Awesome. Fantastic. Well, we were just chatting a little bit before we went on the air here, and we were talking just a little bit. We're practicing. I was getting a chance to practice my French, which I love. And I was shocked to learn that Rachel's not French. She speaks great French, like a native, but she's obviously, as you can hear from the accent, originally from England. And so give us just a little background on, so you're born and raised in England, but how did you get into, tell us a little bit about your background and how did you get into medicine as a profession?
Yeah, so I spent most of my childhood in the UK and trained in the UK and did all of my medical training there. But I think towards the end of my university time, I started to become quite intrigued about what was going on elsewhere in the world, and particularly around people's health in different parts of the world. So I was very fortunate. Most medical schools in the UK, somewhere towards the end of your training, you go and spend some time overseas or in a different environment, to really sort of explore what else is going on. So I spent some time in South Africa, and that really opened my eyes to, I guess, a very different health system, very different health problems. And it kind of gave me a little bit of motivation to continue to explore, really. So as I continued training in the UK, I was working as a hospital doctor, adult medicine. I decided to take a bit more time to see whether I wanted to work in different countries, to learn a bit about tropical medicine. And I was also, I loved language, as we were just talking in French. And I said, I originally studied Spanish. I absolutely love Spanish. So I spent some time in Honduras and I worked there with Save the Children. And again, it was an experience where it kind of gave me a moment to reflect on my skills, my skill set, what I could do to impact the lives of people and how I could support people to be healthier. So I share those two parts of traveling because I think that really started to waken something up in me as to kind of what else was there. So I decided I wanted to explore more around global health and looking at bigger issues, how to address, the inequalities in health that exist around the globe. And that took me to specialize in public health. And by doing so, I decided I wanted to move to France. And I was next to Geneva, so on the border between Switzerland and France. So I could see what it was like working in some of the UN organizations, and explore what that was like from a work career point of view. But I would say at the same time, I've always really wanted to have a good work-life balance. That's been something that I definitely lacked in my earlier part of my career. And I love the mountains. I love nature. I love being outside. And I was spending more and more time in that type of environment and spending more time, as many Brits do, coming to France. So it felt like a very natural decision to move my life here. And now I get to spend and live in the mountains. And I am very lucky that I can continue my public health career and my work that I do. But by choosing those things, I think it's allowed me to also explore other aspects of my life, which is where the yoga comes in. So yeah, it isn't necessarily what I thought I would be doing if I looked back 20 years ago. But I can see through my story, as with so many of us, there are moments that have changed what I've eventually ended up doing.
Sure. Totally. Totally. Thank you. Amazing, amazing story. Yeah, we were talking. I love the mountains. My wife and I, we live in in a mountain community just east of Los Angeles. But I actually met my wife on the Camino, which starts in the Pyrenees Mountain area where you are. So that's where we met actually several years ago. So I'm totally just a fan of your area and love where you are. I'm curious just to know, okay, because you're obviously passionate about helping people and public health in your own life, in your own journey. When did that begin for you? Like just the concern for the well-being of people. When did you notice that kind of springing up inside of you? Was it in childhood? Was it, when was that begin for you?
Wow, that's a good question. I think quite early, actually, like probably as an adolescent. I was already looking to do jobs, part-time jobs that were caring roles. I think it was it's interesting because I think that came at the same time as kind of being intrigued by science. I loved science at school, but I think the caring aspect of it, came quite early on for me. And I think I've always really loved supporting other people, whether that's through health choices or life choices. And so it's something that is now a big part of my life, is to work with people. And I love working with people one-to-one. And I think that's what I loved when I was doing the clinical work, because you are in such a privileged position that you really get to support someone often at the time that they are really in need. And so now through my yoga work, I get to do that one-to-one work, which is, also a privilege, to work with people when they want to open up and be vulnerable and share things.
Amazing. Absolutely amazing. So I wanted to ask you, so you went to South Africa, okay, after med school, right, to work, just to get more experience working with people and different cultures. So you went to South Africa, and then eventually that led you to Honduras. Is that correct? What did working in those environments, obviously, South Africa and Honduras, just challenging environments, different than maybe Europe or the United States. What did you see it in regards to health, and what are people dealing with in more, third world types of places? What was like shocking to you? What opened your eyes there?
Yeah. So I think there's two things really. One was the systems that were either not in place or very different. So my experiences were quite contrasting. So in Honduras, I was in a very remote community where you could only get there by plane or boat. There were no road access. So I think being in an environment like that makes you really aware of your limitations as an individual, and also made me very aware. I was quite early on in my medical career, but it made me very aware of how reliant we are on diagnostic tests or scanners or x-rays, all these things that we have at our fingertips to help us make assessments of people just didn't exist in that environment.
Sure.
So it made me very aware of my own limitations, but it also, I think, yes, the illnesses have a different pattern because so much of it is impacted by the environment in terms of the social environment, the economic environment. And so those communities that I was working in had to think about health in a different way. It was probably the first time that I started to really think about prevention aside from just treatment, because the treatment didn't exist,
It's not there. The apparatus isn't there. Okay.
Exactly. So, the drugs weren't there. So it was like this moment of like, okay, so how can we start to prevent ill health?
That's very fascinating to me because, okay, so in your medical training as a doctor, how much focus was there on prevention? Was there a lot of focus? What was your experience like in your system, just being trained?
Yeah, so I think that this is something that is changing now, but there was a very, very heavy focus on treatment. and less so on prevention, less so
Like,
on modalities
like
of staying well, you know?
totally. So like pharmaceutical treatment, surgical treatment, but and then all the technology that relies upon to even
Yeah,
diagnose, but it's not getting to the root causes of health. Okay.
exactly.
So you started to
Exactly.
see, okay, we're limited. We don't have the technology in some of these places around the world, don't have access to the treatments, the drugs or the surgeries. So the question is like, how do we actually help people maintain a state of health and well-being?
Yeah. And seeing that sense of health as such a connected thing. Like,
Hmm.
I think, certainly, 20 years ago when I was studying, health was seen as more of lack of illness.
Okay.
Whereas,
Totally.
looking at health in a different way and realizing that everything around us impacts our health.
Mm.
The economy around us impacts our health. The society that we live in impacts our health. And I think just seeing that broader picture was the start of me really wanting to try and change the way I could impact people's health on a different level.
Fascinating. Fascinating. Oh, that's amazing. That really is amazing. I don't know that, usually when I'm, and I know in my own journey, it's usually when people hit the end of the road, when with the, medications and surgeries that they feel like, okay, there's got to be something else out there. So, I grew up, my dad, he had a very serious form of anemia that had no known cure. And it was getting really to a point where he was going to need blood transfusions and there was really no cure for it. He got very desperate, and that led him to starting to explore alternative forms of health and really getting to the root of chronic disease and that kind of thing. And so as a child, I watched that and I thought, oh, that's amazing. But it's interesting from a healthcare perspective as a physician, for you going to these other parts of the world, wanting to help people, but realizing I can't, like the training as far as medications, surgeries, it's just not an option. So now we have to get to the root. That's so fascinating. Because there's a big conversation here in the United States, obviously, about healthcare and providing access to healthcare. But then, I think sometimes what's missing from that conversation, as you touched on, is what is healthcare? Are we talking about access to treatment, which is one aspect? Obviously, it's important, but or are we actually addressing root issues? And what is more sustainable, in the long run for the planet, for lives? And so I love that you're doing that work. So my question is, okay, so yoga, where does yoga come into the picture? So maybe you could share a little bit. I wanted to get your insight, and maybe you could help the listeners. Like, if somebody who's just listening to this conversation, they might have a perception of yoga. I know here in the West, it's a very common perception. It's like, oh, you mean getting on a mat and doing some stretches? Is like that what yoga is? So how do you understand, what is yoga? Is it just physical postures?
Yeah, I think you're right. So many of us see yoga as the physical practice of yoga, the asanas, the postures that people move through. And that can often be the gateway, I think.
Sure.
For many people, that's the first thing they do. For me, it was the first thing I did. I saw classes. I would always want to go, but I was a bit intrigued and sometimes didn't feel like, was I that person? So, and I spent a lot of time. I would often book classes, cancel them. I was living in a more chaotic way. But I think through my own journey of yoga and exploring yoga and learning more about it and training to be able to teach it, yoga for me is now much more a lifestyle, and it encompasses so many different practices that what I like to try to do is live in a way that is more gentle to the environment around me, the people around me, and take on board what we call it as a yogi, we would call like ahimsa, which is one of the principles that drives how yogis live, which is like non-violence. So it's about not harming. And I think when you take on some of these principles into your life, then it starts to impact everything you do. So it starts to impact the conversations you have, the relationships you have, the decisions you make, the way you live. Now, that does not mean that I get everything right. I still do everything Sometimes I react, and I don't mean to react in that way. But I think for me, it's about moving from the doing to the being, and also tapping into that consciousness. So many of us are driven by our subconscious, and a lot of that is like programmed into us from such an early point in our lives that we respond to things without even thinking. And so trying to move away from that subconscious all the time and be much more conscious is a practice that I try to do. And that for me is about living yoga every day.
Yeah. This is something that I often say, but I'll say when it comes to spirituality, I mean, the basic essence is it's beyond the physical. So that consciousness that you're talking about, with yoga, my understanding is that it's a pivoting, right? It's a pivoting of our focus from the external to the internal, but that internal is really, if we look at even quantum mechanics and what we're understanding in the quantum science world, is that it's going inside where we discover the roots of everything, roots of existence itself, right? By going into the atomic structure beyond the physical, quote unquote, 3D space-time dimension, that we start to tap into this realm, this, if you even want to call it that, it's just this base, the underpinning of everything is this conscious awareness. And that's my understanding of what spirituality is that it's just, we're going beyond the physical, because spirit is simply something you can't quantify or define in very, physical terms of here and there and, width and height. That's not like that. So that's an interesting phenomena, but it took me a long time to realize that yoga was actually it just means union, right? So union, internally, most people have a sense of disconnection at the state of being. So I want to get your thoughts on this, because I was talking to someone recently who practices Ayurveda, which is a whole health system, Ayurvedic medicine. And I asked him, I said, what is the root cause of chronic illness in your understanding? And he said, the root cause, going all the way back, he said, is perceptions of separation at the level of consciousness, at the source level. And these perceptions of separation create, disturbances in the system. What's your thoughts on that as a healthcare person?
Yeah, I mean, I love that. I think, I talk a lot with my clients about connection, because I think so much of what we have evolved to and the society that we live in, we become so disconnected. We become very disconnected with our bodies. We've become very disconnected with our mental well-being. And as you say, those deeper layers of actually what's inside, what is actually driving us to keep doing and moving. And I think we also become disconnected with the world around us. And so that sort of manifests itself in so many ways, because you sort of see it manifest in a sense of food, of the way we move around the world, the way we interact with people. And so I think when you start to practice things like yoga or some of the sister practices like the Ayurvedic system, which, sits alongside yoga, what you start to do is to be so much more aware of that connection with yourself. So yoga really is such a great tool to get connected to your body again, to get connected to your breath again. And I do think that if you do those practices, we know from the science that does have such an impact on chronic conditions, on preventing ill health, reducing stress, anxiety. And I think that is because you're actually listening. You are reconnecting and you're listening to what's going on in your body. And you see your body in a different way. So if you take something like food, a lot of people just eat without realizing that food is nourishment, and that what you put in your body is going to impact everything that goes on in your body, and how you can use your body as a vessel, if you like, to live. So does it sit alongside my medical world? Yes, I think it does, because we talk a lot about in medicine of, the patient self-care and being more able to take decisions and be autonomous. And I think that the more connection you have with yourself and your body, whether that's your physical body, your mental body, your spiritual body, you can understand when something is wrong, and you can calibrate, you can make decisions, you can be gentle for yourself. I think it does help. It's not going to stop all disease or illness, but I think it has a huge role to play. And that's where I think there can be so much benefit from being open to holistic approaches to health, because they have such a potential to sit alongside these more, medicalized approaches.
Absolutely. What I'm hearing you say is that it's really, to sum it up, is when you get into a practice, right? Like a yogic practice specifically, you're really tuning into the body, you're listening to the body. And when you listen to the body, you're going to catch things much earlier. You're going to know when something gets off, because you can, your body's a system. There's energy, there's all kinds of things. Usually before an illness becomes full blown, if you're in tune, you can sense it pretty quickly. I actually was having a conversation with somebody on the podcast recently, and he said that by the time the symptoms of an illness show up, it's the fifth stage of that of an imbalance that has been there. So what I'm hearing you say is, if you're tuned into the body, you're gonna catch that imbalance much sooner before it gets to that fifth stage, so to speak, where it's actually manifesting as physical symptoms. Is that correct? Is that kind of what you're saying?
Yeah, I think that's definitely a possibility, because I think what it does is it allows you to, and this is what you were saying about that sort of inner reflection. I think if you live without any of that inner work and any of that ability to understand yourself, then it's very hard to know, for instance, when your anxiety levels are rising. And something like that, you can be living with a chronic level of anxiety, and the trigger point may be when it reaches a very, very high level, because you're just living in that world without really looking back. And if I look at my own experience, I was definitely doing that when I was working lots of shift work and studying really hard. And I was in this wheel where I was just continuing. And I was not really aware of my own energy levels. I wasn't aware of my own anxiety levels. And it could have reached a very high point for me. Thankfully for me, it didn't. But for so many other people in environments like that, they're living with chronic stress, chronic anxiety, poor sleep, so many things that we know lead on to other conditions and other illnesses. So it's not necessarily that it will prevent every illness showing itself, but I think it allows us to be in tune. It allows us to understand our bodies more, and prevent us from getting to those big trigger points, which are often difficult to come back from.
Totally. Absolutely. And I've heard so many doctors and people who work in the healthcare field, because the need seems so overwhelming. You look out there, you see, the challenges are endless. So there's a tendency for healthcare professionals to get way out of balance, to work themselves to a point where you're saying, like, they may have chronic anxiety, exhaustion, fatigue, all of these things. So for you, it sounds like you realize, like, this is not, you're kind of going down that road. And at some point you needed a boundary, or to create a set of boundaries for yourself. Can you explain that a little bit? How did that open up for you? And my second question is, and maybe this is a completely separate issue, but at some point you moved to France and have now settled in the Pyrenees Mountains, and now you have you become a yogi. How did that specifically happen for you?
So I'll take the first bit first. So I guess you're right. So many healthcare professionals are in a chronic situation where they are in a very stressful environment, lots of trauma. We are also trained to not show emotion because the patient is priority. So you are dealing often with very serious situations day in, day out, but your job is to support someone else. And I think chronically over time, that can have quite a lot of effects on your self-efficacy, your self-compassion, your ability to understand what your true values are.
Sure.
And I could feel intuitively that something was out of balance for myself, that my energy was off. Like I knew that the environment that I was working in was draining for me. So as much as I loved giving that clinical care to patients, I just knew it was totally draining for me. It left nothing else in my life. It left no time, no space, no time for relationships. And I think I could feel that it wasn't the right environment for me to be working in. And to move from that to a different career and then to continue to explore other career options, I think the very initial part of it was really understanding my values. And I was fortunate to have some coaching, which I think was really fundamental in exploring what those values looked like. And then knowing why something felt off. Why did that not feel good for me? Well, it was because it wasn't meeting some of my core values. And so I think that was a really fundamental step for me to be able to pivot and move. And something I've always really struggled with was finding role models, particularly women. I could never really find role models that I kind of thought, yeah, I want to be like that person. And that's something that I continued to struggle with for quite a long time, actually. And then I realized two things. I realized, one, often your role models are doing something completely different. And what you're learning from them is the way that they're living and the way that they're, exactly.
Totally.
Rather than a job title, And the second thing I learned was that you can be your own role model. So I started to do a lot of work about my future self and realizing that my future self, which is a lovely visualization if anyone wants to explore it, is that my future self can be my role model. And that gives you the strength to continue moving on with your passions and your, dreams. So that was my transition. And I think, I'm still transitioning into, and I think that I've always had that feeling of me that life is about exploring, whether that's a hiking path in the mountains or a different country or different people. That for me is the delight of life, really, that we can, the variety, to meet different people, to speak different languages, that all adds to that richness. So moving to a different country was it's a huge life change.
Oh, yeah.
Moving to a different country that speaks a different language, very big challenge. But at the same time, I think it never felt any different from any other decision I've ever made, because I kept with myself the vision that I wanted to create in my life. And that I guess that inner knowing that I could make decisions and try things, and it was going to show me whether one thing would work or not,
Amazing. So what I'm hearing you say is, working in the medical profession, you felt, okay, my energy's, there's a shift here. You're being drained. There's nothing left really for the life that you want. And you realize, just doing some inner work, coaching different things, that you had some core values and they weren't being met. And I think that's so important. What you're sharing is so important because, how many of us are suffering? I know for me personally, I spent years out of alignment with my core values because I was following a role, right? A role that somebody had prescribed for me, the society had created for me, or expectations of my family. But when you're out of alignment with your core values, suffering is almost a notification, right? It's a call home to say, hey, where did you go? Like, you're over here. And so so I'm hearing you say core values are important. So getting realigned with your core values was key for you to move into who you actually are. And then, of course, I love what you're saying about role models because, or some people call them archetypes, or you can have those from history, or you can have them from, people who are alive today, people, people that maybe are more public figures or whatever. But if there's something about them that grabs you, I love what you're saying, because a lot of people make the mistake of thinking, I have to be just like that person. I have to do what that person is doing, or have to be exactly the way they are. But there is some dimension of their life and being that is awakening something in you that mirrors that. That's what I'm hearing you say. And I love that. That's a very unique perspective to say, I don't have to be like that person, but there is a way of being that's calling out to me. That is, and then to have yourself, your future self, as your role model. Amazing. Yeah. So did you picture yourself, your future self, at one point living in the Pyrenees Mountains or the mountains somewhere, being a yogi?
Yes, I did. So I probably had two moments where I really visualized something very strong. And one of those was when I was being coached by a career coach, and I was really struggling with, what direction to take my career in. And all I could visualize was a group of people sitting in a circle. And I just couldn't get beyond that. And I remember at the time thinking, well, nobody does that in public health, or, I've never really sat around in a circle other than a meeting. It felt very sort of odd that I was visualizing this meeting. Then roll forward a few years, I decided to do my yoga teacher training. And I did some in Switzerland, and then I went to Portugal to do a much longer period of training. And I had this moment where I realized I was sitting in a circle with all these other teachers training, and I felt 100% myself, 100% the person I wanted to be. And it came back to me, and I realized this is my circle. This is where I feel, most at home. And then more recently, I've used the same approach to visualize. And that has always been a little house in the mountains, surrounded by forest, looking out into the high mountains with nature around us. And that's where I am today.
Absolutely amazing. I love that, because that's a possibility for every one of us to begin to tap into. But again, to have that vision of a future self, like, how do you even get there? Well, that's where yoga comes in, right? It's that union within that gives you access to be able to even see that dimension, quote unquote, in the future, if you want to say, but to be able to create that. So and when you're in survival mode and just reacting to life, access to that dimension of being can seem almost impossible for folks. So, but that is what's possible when you begin to move into that inner state of being, that you can then visualize and create the life that you want, as opposed to just react and try to keep your head above water. So, such a better way to live. It's amazing.
Yeah. Yeah. And people talk a lot about manifestation, don't they? Which I think is really interesting, because I suppose that is manifesting.
Sure.
But I sort of see it as if you understand your inner self, and you understand what drives you and your values and how you want to live, then you can have quite a clear vision of what it looks like for you. And that obviously is going to look different for all of us, the people in your life, the things around you, the environment around you. But I think having that goal and being able to visualize it so clearly gives you purpose and gives you somewhere to move to. So whether you like to call that manifestation or visualization, or I think it falls into that same ability to continue moving forward, to live the way that you want to live.
Totally. Absolutely. What would you say are your core values that you had to get very clear about?
Yeah. So for me, I think some of my key values are around authenticity and being open and honest, and that element of trust and respect. And so I know that if I am ever in environments where I feel like any of those are out of line, I feel
Sure.
very odd. I this is why I love one-to-one conversations. I love podcasts because you can really have such an authentic conversation, right? It's two people exploring. But if you are having a conversation where you feel like the other person is leaving a little bit behind or they're not respecting your response, then I find those things very difficult. And so,
and energetically, you can feel that pretty quickly, and you go, okay, there's not alignment here with my core values.
Exactly. Yeah.
And if you know that, you won't put yourself in those situations, which is really what a boundary is, right? So creating a boundary to say, okay, this doesn't respect who I am as a person.
Yeah.
Super, super interesting. That's really good. Really good. Okay. I wanted to ask you, just as a yogi, right? There's a lot of different forms of yoga, but karma yoga. Can you talk a little bit about what is karma yoga? What's the distinction? How does it differentiate it from maybe other forms of yoga?
Yeah. So the way I see it is karma yoga is one of the sort of limbs, if you like, of practices of yoga. And for me, it's about non-attachment to an outcome. So it's living in a way that is much more about seeing yourself as part of the world around you and not just on the world, and acting in a way that you are not attached to what the outcome of that action is. So in a very sort of simplistic example, I've done yoga retreats where you are a karma yogi. And so that would look like going to stay in a retreat center, but instead of going to the retreat center and thinking, okay, these people are going to give me my food every day. This is beautiful, amazing vegetarian food. I'm going to go to the yoga studio. You also are there to be of service. So you might sweep the floor of the yoga studio afterwards. You might help prepare the food. You might clean, for example, or go pick vegetables. And so that aspect, in a very simplistic way of describing it, is your actions are there for the collectivity of human beings rather than solely for your own purpose.
Totally. Okay. Because the essence of karma being action, right? So you're taking action, but it's a conscious forward action that is not just about what am I getting, but it's about giving back from this practice. Okay. Amazing. So good. And so karma yoga is really focused on action. So obviously it would make sense, being that you are passionate about health, helping people heal, become whole, that karma yoga is kind of your path for you. It's not just hey, this is a job I'm doing, a career. It's my career. It's like, no, this is my, some people would say dharma, just your essence in the world, right?
Exactly. Yeah. And so it's an approach, I guess, of living in a way that, like you say, allows you to have that balance. And I think that goes back to the energy of giving and receiving energy, so that you are doing that in a way that makes you feel balanced, that you're not just giving. And I think that's a lot of healthcare professionals and people who are carers, whatever role they're in, can fall into the danger of giving. So their energy is all outwards and then not receiving the energy back to themselves. And that can obviously not be sustainable in some situations.
Absolutely. And I look at it like breathing, right? It requires, it's a flow, right? It's inhalation, exhalation. If you don't inhale, you can't exhale. If you don't exhale, you can't inhale. But that's a pattern for life, right? It's just about flow, energy flow, income and outgo. And they must be, you need both. and they both must be in rhythm with each other. So good. What would you, if you had an opportunity to speak to the medical community? I know that's kind of a large thing, but what do you wish the medical community, and by medical community, I'm talking about strictly, mainly Western modalities of medical practice. If you could speak to some of those folks who are in that world, what do you wish they would understand about yoga?
I think it would be about being open to the possibilities and the advantages and the benefits of practices like yoga, like breath work, like meditation, in supporting people's health. So I think it would, if I could say anything to my colleagues or the rest of the community, is just to be open to those approaches and realize that we don't always have the answers. And it's okay to re-question some of those things. And I've had to do this myself when I've been training as a yoga teacher, is to realize that, for instance, the chakra system. So like the ancient yogis came up with this amazing system.
Sure.
And that's what they would, pass on generation, and it's a very well practiced approach to energy and to healing. And it's fascinating that if you look at the chakras, it's also where you have your neural plexuses, your collections of nerves in the body. Now, how did the yogis know that, right? That's a big
several thousand years ago, right?
Yeah. It's fascinating. But for me, as someone who had a very scientific training,
sure,
exploring things like that, it can sometimes be quite threatening because you have a sense of what you know, someone tells you something else. Now, I think if I could say anything to my medical colleagues is be open to other approaches. It doesn't mean that the approach you're giving or sharing with patients is wrong, but it may mean that there's something else that can also be beneficial and additive. And when there are these modalities, and for me, there's so few negative effects of these practices of yoga, of meditation,
right.
there's that actually to explore them and to understand them. If you can do that yourself as an individual, then you can share that with so many of your patients. And I think that is the potential power of the healthcare community by adopting some of these practices, understanding them a bit more, being open to understanding them, and being able to, signpost people to them or share them, because they are so beneficial. They're often much lower cost. They can be so sustainable for an individual to do, and potentially reduce masses of ill health and pressures on healthcare systems.
Amazing. Absolutely amazing. So what I'm hearing you say is a posture of openness, less resistance. And what are the drawbacks, right? There's no side effects to this quote unquote medication of yoga. There's no, it's at the end of the day, you have nothing to lose in this. And just that posture of openness can actually get you where you want to go, but it can feel threatening. I think sometimes there's a belief of, well, what does a yogi 3,000 years ago, how can they even understand or come to some level of expertise in the area of understanding the human body and how it works? But amazing what you're saying about the chakra system, the energy points, like, oh yeah, we're seeing now just how those points along the human system are very key points, there's nerve bundles there. We didn't know that 3,000 years ago, but they had a perception. That means they were seeing something. Questions, how did they see? They didn't have X-ray machines or MRIs or anything like that. They were having a perception into a dimension, which is, do we still have that access then? And then the question is like, well, what were they tapping into that gave them this fundamental information and knowledge? Do we still have access to that? And the answer is yes. We do. All of us do, which is incredible when you think about it. I love that that encouragement to the medical community to just be open, because I feel like the majority of people who are in the medical world are there because they desire to help people. So this is actually, it's almost, this is not, this was going to lead you to your goal quicker than maybe if we were more oppositional or not open to these new or different ways of understanding health. So it's so good. So good. What would you like? So last question here. What would you like people to understand about yoga, about health? If you could just, if somebody says, well, where do I start? What's the one thing I can do, or how do I start? How would you like to encourage, or what would you advise people who want to go deeper in this?
So I think from my experience of behavior change, and so much of health is about changing behaviors, is that it's so important to start small. And so I think that that's what I have found so successful myself and with my clients, is that by starting with really small changes, you can build up to make huge momentous changes in your life. And I think that can be 5 minutes, and we all can make time for 5 minutes. Even the busiest professionals doing the highest level jobs, or, people at home with their families, lots of children, 5 minutes is usually possible. And so I think that it's about realizing that it doesn't have to be big. It can be very feasible, and adding things in. And I think that takes away the mystery. And
Sure,
so
totally.
for me, even though I had a physical yoga practice for many years when I started exploring yoga, meditation was always something I saw as, other people doing. And I was intrigued, but I thought, I just don't know that I could sit still for that long. And so it was a barrier. I created my own barrier really to exploring it. But then when I actually started to really break it down into the tiniest sections, and I started building up a 5-minute meditation practice, and the power of doing that on a regular basis impacted the rest of my life, impacted every day. And so I think it's just knowing you can make small changes, exploring different things, and finding the thing that works for you. And it's like you said, there's so many different types of yoga. There's so many different types of coaches. There's so many different types of meditation. Don't be afraid to try, but also realize you can find the right thing that is going to be right for you.
So good. I really appreciate what you're saying, starting small, because we think it has to be complex and I have to get it just right. And in my coaching work, that's one of the first things we do in the start of the coaching work, is to begin to introduce very small concepts of breath work. 5 minutes. Actually, it is 5 minutes. We start with 5 minutes of a specific kind of breathing technique just to begin the process. And I think people are caught off guard. They're going, "That's it?" Like, yeah, well, there's a lot more, but it's not less. So, I always say, is there more to this? Yes, but it's not less than this. So let's start with, you got to start at the beginning of every book, every journey. You got to be where you are and start where you are and start at the beginning. And that's where it begins. And it is step by step. It's easy, to, as I mentioned, I did the Camino there and starting in Southwest France there in the Pyrenees. And that was the thought, like, how in the world will we ever do this? How will I ever walk 500 miles and reach the Atlantic Ocean, and it's just step by step, one day at a time, step by step. And then you look back and realize, here I am. And I can imagine for you, there have to be these moments where you are in the mountains, in the Pyrenees Mountains, practice, as a yogi, as a doctor, thinking back, you look back and you just go, am I living the dream here? Is this actually happening? But it is, right? It is actually happening in this moment. If we can all be where we are in this moment and realize, and then when we are able to visualize what can be, you'll end up living that life that you look back and go, I visualized this. I created this, and here I am. And then that's just momentum for what's unfolding now in this moment, which is, it's always ongoing. The journey is always moving forward, which is amazing. So, Rachel, thank you so much for your time and sharing your journey with us. It's just so rich, and I would love to continue the conversation with you in the future.
Thank you so much for having this chat today. Honestly, it's been an absolute pleasure. So thank you. And thank you to your listeners for taking the time to listen.
Of course. And thank you, everyone, for listening. And until next time, take care. Bye-bye. Thank you.